So inserting 4.5,
Healthcare, prisoner healthcare, was that
Inmate,
inmate?
inmate
That's right.
healthcare.
Is that-
Mhm.
I'll need to make that suggestion, or can that come from chair? I mean, I can do it.
As long as you agree to, we both agree to.
It doesn't matter who.
Okay, we are live
You can
streaming.
put it
and
on there.
YouTubing, and
Okay.
we're ready.
Okay, I do have 9 o'clock. At this time, I'd like to call to order the Isabel County Board of Commissioners Criminal Justice and County Affairs Committee. First up, we have an agenda. Is there any additions to the agenda as presented?
Like to add to the agenda between item 4 and 5, the Isabella County inmate healthcare contract.
Okay. There, we'll do that. If nobody objects to it, we'll add that agenda item on there. Okay, any more items? Seeing none, we'll move on to the call to the public. Physically, we not see anybody that's raising their hand. Is there anybody online at this time?
There is not at this
On the
time.
phone? Okay. We'll move on for the call to public. There will be another opportunity at the end of the meeting for the public to comment. Okay, first up, consider approving the software license agreement for Defender Data and the Isabella County Public Defender's Office providing case management software, and authorize the board chair to sign the same. We have Public Defender Houseman here to discuss it.
Good morning.
Good morning.
Good morning.
I should start out by saying that the contract is pending legal review between both our side and Defender Data. There were some things that were changed with the contract, so we're hoping to have that clarified here before next Tuesday. I sent out the changes to Defender Data. I'm guessing Friday, and I haven't heard anything back. So Defender Data is our case management software. Defender Data actually predates me in this position. It was the software that they signed off with back in sometime before I started in September of 2019. And so what actually happened, the reason we're bringing this contract forward is we never actually had a contract with Defender Data before. They actually provided us with a trial version of the software back in 2019, and nobody ever followed through on anything. And so maybe a month and a half ago, one of our attorneys was having some IT issues with it and contacted them, and they said, we don't even show you as a vendor. What happened? And so we had asked, I had asked actually Michelle if maybe she was paying the bill for it or somehow was going to the court or anything. And Chris Whitmer, actually, before she left, had told me, no, they've never been a vendor with our county. We don't know. So I talked to our contact at Defender Data, and they basically said, yep, somebody dropped the ball on our end and never reached back out to you to see if you wanted to continue to use it. The positive with that is that they're willing to honor the 2019 rates.
All right.
So they got kind of to make amends. They were like, you know what, we'll give you the 2019 pay scale, which equates to $2 per case that we put in, or for the year. I think for us is better pay it a whole year at a time. I think it's $4,500.
Did you get billed? Have been paying that?
We have not.
Have not.
Have not. Actually,
I want to go back to the previous.
yeah. So
The trial, yeah.
So
Yeah, that's
that
right.
first fiscal year 20 grant,
Wow.
it was in there, the one that my predecessor had prepared, and it had said $2 per case for Defender Data. And I think I included that in the fiscal year 21 grant. Just, okay, that's what it was. That's what it is. And then realized we weren't getting billed for it. So I stopped putting it in our grant altogether. So it wasn't a line item that, we were getting money for and weren't using or anything like that. It still falls within our supplies and services budget with MIDC. It's not an issue that way.
That basically the company went out there.
No. So what led me to ask about who was paying the bill for this was because we had researched using another company. Saginaw County presently uses Defender Data. Kalamazoo County uses Defender Data, or did use Defender Data. There's a handful of public defenders offices across the state that use Defender Data. And they just provide a month-to-month contract. There's no long-term obligation whatsoever. And a couple, I think Kalamazoo County was the first one that started to go with, it's called Legal Server. And so there was this discussion amongst the public defender leaders across the state about switching and what the best case management software was. A lot of them had decided on this Legal Server. So back in when we were doing grant preparation for fiscal year 24, I had done a training with Legal Server. So this is probably back in February. And they said, yep, this is the cost. We import everything over from Defender Data. We take care of everything. And I said, okay, how does that work with Defender Data? Because I don't pay for it right now. So it was a big question. And so then it popped up with this IT issue and everything like that. So just trying to get back on the right path with Defender Data. But yeah, there are a number of other options. I know obviously the prosecutor's office, and I know sheriff's talked about Carpel. They do have a Defender aspect of it. I don't know anyone that uses it. I think they focus more on the law enforcement side versus law de-enforcement side, I guess. So I don't know anyone. Yeah, I don't know. I don't know anyone that uses it. I haven't heard, and
There's no
I think they
sides here.
focus.
Well, considering we're gonna pay it for, we probably should stick with them. So.
Yes, that was kind of my feeling was.
Yeah.
In the
If it's
short
safe,
term,
it
to
is.
save your data, this might be a good
bill.
month.
Precisely.
Since it's
Yeah.
Precisely.
Yes.
And $2 a case doesn't sound like
Well,
huge.
No, not at all.
Expense.
And that's the 2019 rate. So I think they've gone up to maybe $3.
yeah, right. But then again, it's also covered by MIDC. Not to say that we shouldn't look at it, but you said yearly is 4,500.
Correct. I mean, there's
And-
there's two different pay structures at the end of the contract.
Right.
$2 per case, 25 per user per month, I think equals out to $4,500.
Right. So,
But it all fits under that. Because if you look at our MIDC grant, when we look at BSNA, we obviously have, probably 50 different line items. But according to the grant, we only have about 5. So most of those, what we have in BSNA all fit into one larger line item with MIDC.
Hmm.
So it all falls under supplies and services.
I don't have any more questions.
No. thank you.
I don't need-
All right, make a motion, move to consider approving software license agreement between Defender Data and Isabella County Public Defender's Office providing case management software to the Board of Commissioners meeting this Tuesday.
I will support that. Is there any more discussion on that? Seeing none, we'll proceed to vote. All in favor, say aye.
Aye,
It has passed, and we'll move that forward. Thank you.
Thank you.
thanks.
Thanks, Tom.
Okay, next up, we have a proposal on the inmate health contract. Sheriff.
Last minute entry.
You need me to make any copies, Sheriff, or did you come? with
I
these?
came with a brief.
You
well,
came, that's
well,
what's
pass the
important.
brief
You're
out.
here.
Right.
Here.
And
Perfect.
printed on back and
Perfect.
front and back. So we're kind of safe
Perfect.
place here. Apparently
Thank
still.
you. Well, you could
Front back is
could
good.
have done both. That
Uh,
looks probably important.
Yeah. This has been a struggle.
So the agenda item that was added very skillfully, Isabella County inmate healthcare contract, just so you're aware.
This is a proposal to do the RFP, correct? Or working through the process.
Correct. Let me know, commissioners, when you're
Okay.
ready to get into it now.
This has been a 3-year with WellPath, right, Sheriff? I think 3 years.
Yeah, the original was 3 years.
Only inmate medical, is that all that WellPath does?
Yeah, I'm not sure if they're branched out into other places or not. Some do schools and things they may, but I'm not aware of that.
You know, we've historically had that discussion trying to figure out how our healthcare could pay for inmates. I'm just sitting here wondering, could WellPath cover any of our healthcare needs? For our employee, you know what, we're paying that anyway, maybe
Mhm.
work it the other way.
They may have some avenues there, but.
All
Yeah.
set?
Nothing great about it. Other than WellPath, has been a really good service for us since I started in 16. They've been here and they were here prior to that. They do provide us a great service. So as the document read here, several months ago, we got a letter from WellPath indicating it was going to go up 150 to 180,000. We're like, oh, wow, that's a lot. The contract is due October 1. It's up. So we scrambled and got our RP out, thinking that we need to relook at this. Unfortunately, we had three vendors out of the several that were interested submit. The one vendor, ATC, they just provide manpower. They don't do anything else. That's a pretty heavy lift to pick up the rest of that and find somebody to do all that. So we kind of ruled them out early on. The second one, ACH, is a good company from what I understand, but as you can see, it was $200,000 more than what WellPath was. So financially, you know, with situations we have going on in the county, it just wasn't feasible. So we're back to WellPath looking at their services. We did have a quick meeting with them yesterday. It's kind of why it's kind of late getting to you folks. We had some questions. We wanted to make sure we were understanding what pass-through really meant, because a lot of them say talk about pass-through. we were hoping that pass-through did mean that number that you see is what it takes to have WellPath or any other, because they all do this pass-through, have that services in the jail, and then on top of that, we're getting billed for prescriptions and other things. That wasn't the case. It's similar to what we have now, where like there's $80,000, I think, on that back page for like pharmaceuticals and stuff. If we go over say it's $84,000, we go over that. But on the on-site medical, we only use 7,000. They'll move those line items around and kind of cover that.
Oh,
As you can
Nice.
see, though, we did go over last year, the 45,000 cap overage. And it just has to do with some of the medications and HIV drugs and stuff are just extremely expensive. I'll tell you, the WellPath and our nurse is real good about bringing those to our attention, saying, hey, we have an inmate that has extreme medical conditions, going to be very costly. And that gives us the opportunity to reach out to public defender's office, David's office, whoever else in the courts, to see if there's other avenues, you know, home confinements and things like that, to kind of take that off our shoulders. They are good about that. I think we mentioned, we were talking the other day, Commissioner, about, you know, if we can get the Medicaid, Medicare situation under control, that would be a substantial game changer. I know they're pushing us up that from MAC and everything else,
Mhm.
but I haven't
Not a
seen any movement here in a little bit on that, but if we could ever get to that, that would be huge for jails and counties. So we're kind of in this catch-22. WellPath did say that they'll stick with us, you know, into the next few days, you know, to get to the commissioners meeting to make a decision. I have an email ready to go out. It has all the RPs in it. It's 233 pages long. So if you're finding trouble trying to get to sleep at night, I would recommend that reading. And they are hard to, and this is the second or third time I've had to do this. And they are hard to, just apples and oranges. They all kind of like give it to you differently. It's not laid out real well. That's why we created this Excel on the back of that second page, you know, trying to understand it and make sure we're not missing anything. But at the end of the day, you know, it is a substantial increase. We do have it covered in this year's budget already. And they are a good service. There's nothing, they've done great with us. They've been great with our employees. They've always looked after us and out for us, and we've had good relationships with them. So I have no issues at all there. It was just a financial substantial increase that pushed us to the RFP to really review it. And this is our findings. I mean, this is why we do it, to see. So apparently that is industry wide at this point, that the cost went up everywhere, which you can pretty much understand that it's went up everywhere. So that keeps our mental health services the same, and our nursing the same, our doctor visits the same. So everything stays pretty much the same. So
which they do all that really well from what you've said in the
they
past.
do, they really do take good care of us. And I've always said, you know, the nursing staff is almost like family to us, not a contracted service. I mean, you know, we invite them to our Christmas lunch, and we, you know, those kind of things, you know, they just take good
Well,
care of
they're
us.
there.
So they're there every day with us. They're like one of our own, and we make sure they're safe. And I'm sure they would be excited to make sure they get into the new medical unit and a new facility versus that closet they're in. So
Yeah,
after all those.
Oh,
years.
yeah.
I'm sure they're just anxious.
So my I'm sorry, go ahead.
sorry. So we budgeted for the increase. Is that because of conversations you had with
Yeah.
WellPath prior to this
Yeah,
year?
the letter we received,
Knowing
we
that,
do.
Yeah, they're gonna increase the cost.
Yeah. So we, you know, and it was difficult to really nail down, other than we had that letter we had from them. So we just ballparked high,
Mhm.
you know, and
Conservative.
conservative. That's
Yeah.
how, And then if we have some
It
more.
was a
to
tough
visit our-
budget meeting. That was eyes wide open, but
Yeah.
that's a have to, right?
Yeah,
And it's frustrating. The previous contracts with them, the CPI has been at 3%. This one's up to 4.5. So that went up as well.
Sure.
The one thing about this is it's a 1-year contract with the ability to renew it the way they want to do it, which is probably good. Maybe there's some other options we can keep exploring. We're not on an island alone. I know I've talked to the sheriffs in the surrounding areas, and they're all pretty concerned about this massive increase. So I don't know if there's avenues to share that load, if there's avenues with our local medical facilities to contract something. I mean, there's some conversations maybe to have in the next 365 days to see if there's other options. Maybe, you know, some places hire their own nurses. So maybe you hire your own nurses, and then you have a contract with a doctor and so forth. So there might be some opportunities there to do something different, but we need a little more distance. Keep our message.
just thinking out loud, is that a issue for the healthcare committee to kind of explore?
I
as
know,
well?
it seems so aligned,
And
doesn't it?
we've had some conversations about prescriptions. Could we could we get prescriptions from some of these groups that we've talked to and interacted with? The one group seemed pretty positive that they could probably cut prescription costs down for us. So that was an interesting
Mhm.
conversation. We didn't go with those folks, but it wasn't that we didn't go with them. We just pushed it down the road a little bit, and still
Yeah,
having those
yeah.
conversations. So there are a lot of conversations, I think, in the next year that we probably
Mhm.
should continue to have and see really what exists. Our sheriff's conference is coming up here in about 3 weeks, and I'm curious to sit around the table and have a hamburger and talk to my colleagues
Yeah,
about what they're
yeah,
doing,
yeah.
what they're thinking, and kind of get some better ideas as well. So,
Yeah.
Just curiosity, I know, on the ACH, they talk about a per diem rate. Does WellPath that do a per diem rate?
no,
I have an issue with per diems.
no,
Those things are being used a lot.
yeah. No, they don't. It was just that one they had that. And I was kind of surprised, like, we were pretty clear of the services we were looking for, and they just said, we'll give you bodies. You gotta do everything else. Well, that's not what we're looking for. I mean, it's a lot of work to do medical billing and prescription ordering, and you gotta pick it up and you gotta get it delivered. I mean, there's just a lot to that. I mean, it would be, I'm not even sure one person could handle that, but
I like their negotiation, 7% or whichever is higher.
Yeah,
Yeah, right.
Yeah.
I've never seen that in a contract.
they were all very very
Gotta leave it open.
loosey goosey, for lack of a better term. You know, I don't think they want to get locked down just because of the volatile medical costs right now, and they were very like, here it is, but this is all you got. So,
You can have it regardless of-
well, again, it was over 7,000 sick calls and referrals to the nurse last year. I mean, that's 7,000 inmates that got seen. And I guess I could have put in the number of times we went to the ED, but I think it was about 15 or 20 that we sent people that would have been after hours, or they were chest pains or something. So out of 7,000 visits, we only had 10 or 15 that went to the hospital to get checked. And that would be extremely costly, all the ED visits and so forth. So
Okay, any more questions for the sheriff?
I appreciate you sticking me on the agenda later. We were been rushing the last few days, and it's go live today for the CAD and RMS, so everybody's scrambling left and right. It's just been it's a busy week here. So.
Now we, so it sounds like you were looking at wanting to renew with WellPath. Do we want to make that in the motion to bring that forward, or am I just bringing a general motion
I
forward?
think we'll
of
bring it
this?
forward and you guys can clean it up in the work
Yes.
session.
Okay,
We'd love that dollar amount to be in the motion if you can.
The
We'll make
dollar
sure
amount.
it's in the motion for next.
Okay.
Tuesday.
So we just need to pass it forward and then we'll clean it up.
All
in
right.
the work session.
I think at 10 or 11, you, Melissa, and Brian will get the full packet of the 233 pages of
Thank
everything.
you.
Should be, I just want to make sure there was any questions or things I need to adjust
Sure.
before I went and set
Sure.
that.
We'll make sure that they get that ahead of time.
move to bring forward contract with WellPath and Isabella County Sheriff's Department in the amount of $579,130 for inmate healthcare to the Board of Commissioners meeting.
Okay, I will support that. Any more discussions, or everybody understand the motion as presented? Okay, seeing forward, we'll vote on that. All in favor, say aye.
Aye.
Opposed, the same. The motion is passed.
Ladies and gentlemen, thank you.
Thank you.
Thanks, sir. Enjoy your day.
With that, we'll do one more call to the public. I don't see anybody making that's everybody online. That will close call the public, and I'll call the meeting adjourned.
Thank you.